Our next session, Dr. Boja, come on up, please. We're going to introduce our next doctor. Now, Dr. Boja, now, did you travel all the way from someplace far away?
Yes, sir. I think it's, I don't know if it may be 5 miles or 6 miles from
5
this
or
place.
6 miles, right?
It's a long ride, by the way.
It's a long ride, yes, indeed. Where exactly is your office? Which area?
We are located on 1604 and Northwest Military, Shavana Park area.
Yes, indeed.
And then I live, close by here too. So, but still, yeah, it's a long way.
It's a long way. Oh, and we got to get my back on this too, because Dr. Hano was making fun of us. Yes, sir, we do have pickleball. Chicken and pickle is right up the street.
We do have it right
we
here,
have
sir.
it.
Yeah,
Yes, sir. Yes, sir. It's coming. It's
fact.
here. It's not coming. It's here already. So, Dr. Boja, you were here last year. You're going to share some new things with us this year, and we are looking forward to that as well. So I know we started a little late, so I don't want to take your time. So I'm excited to hear what you have. So floor is yours, sir.
Well, thank you, AJ. Yeah, thank you very much. I think we're going to actually, let's offer something different. I want to first thank the organizers and Dr. Prince right there. So they requested us to have something different this year. So it was a pleasure. It was a pleasure speaking last year, and we did, talk about the lifestyle medicine and what lifestyle medicine can actually offer, and then how it can help combat your chronic diseases. But this year we were requested to bring some proof. Are there any real cases? I love Dr. Harvey's talk actually, because I always love, enjoy listening to him. It's not just he's funny, he's a cardiologist. In other words, let me ask this question. What's the number one killer of this country and the rest of the world? Heart disease. This program is actually directed by Dr. Prince. He himself is a cardiologist. And always the prime speaker, we love Dr. Harvey himself is a cardiologist as well. In other words, I hope you get the message. The answer is not in the stents, not in the cath lab. Don't even get to my cath lab, right? Don't try to think about, getting the bypass and all that. So that's the message we should get, meaning there is a solution in your lifestyle itself. So having said that, we introduced what lifestyle medicine can offer in theory last year. And this year, we were honored to bring some of our success cases. And okay, so let's have a couple of slides right there. So having said that, we are bringing some of the evidence, some proof. Let's have the advancer. First of all, are you having fun so far? I know that this is not a lecture mode. I think this is one of the reasons why actually they wanted me to kind of bring some of these real cases. Don't get bored. Feel free to ask questions. Hold those questions up, type it in so that we can answer either today or tomorrow. There you go. Think about yourself or your family. Is anyone in this room or in your family fighting any chronic diseases like obesity, diabetes, high blood pressure, high cholesterol, heart disease, cancer, liver failure, right? Fatty liver, any autoimmune disease? Anybody? Unfortunately, you're not alone. In other words, 6 out of 10 Americans have at least one chronic disease. And 4 out of 10, that is nearly half of us, have more than 2 or more chronic medical conditions today. And that's the sad state of the nation. After practicing for more than 15 years, seeing thousands and thousands of patients, I just came to a realization that every single person is getting sicker nowadays. They're on tons and tons of medications. And sure enough, I caught myself one day turning into one of those patients. And after losing 40 pounds and nearly flipping every lab value, my metrics, I decided to do something. Offer a plan, a program to our patients in our community where they can combat these chronic diseases through lifestyle change so that they can rely on less and less medications. And that's when we decided to kind of launch our clinic in Yumi Health. And sure enough, we are proud of our patients. They embraced the lifestyle change. They followed our protocols, all our instructions. And they did make a difference and started quitting, not just losing weight, 20, 30, 40, 50 pounds, without these crazy Mounjaro, Ozempic, and Wegovy, not just flipping their high blood pressure and cholesterol and diabetes, across the board. They started enjoying a brand new life. And we call them our New Me champions. And it's an honor and pleasure to bring 3 of those. We're actually blessed to have 3 of our such